welcome to the 13th session of New York ACP's series, Wisdom and Wellbeing, Making Healthcare Work Better for Physicians and Patients. Tonight, I'm very happy to welcome Dr. Mariah Stump, an attending physician in women's primary care at the Women's Medicine Collaborative in Providence, Rhode Island, and assistant professor of medicine, clinician educator at the Warren Alpert Medical School of Brown University. Dr. Stump received her medical degree from the University of Vermont College of Medicine and completed residency at the Warren Alpert Medical School of Brown University. She earned a master's degree in public health from Johns Hopkins University Bloomberg School of Public Health. She is board certified in internal medicine, lifestyle medicine, and integrative medicine, and is the director of the scholarly concentration of lifestyle medicine and integrative health at the Warren Alpert Medical School of Brown University. Dr. Stump is a faculty instructor in the resident clinic at the Mariah Hospital and the course director of the Introduction to Lifestyle Medicine clinical elective at the Warren Alpert Medical School, which is the only course integrating nutrition into the medical school curriculum. She's the wellness champion for the Rhode Island chapter of ACP, and she has given ACP well-being presentations at 2 national conferences, San Diego and Boston. She's also a certified Vinyasa yoga teacher, movement therapy and mindful movement instructor, and medical acupuncturist with a special research interest in non-pharmacologic pain management for fibromyalgia patients and those with chronic conditions. So a very warm welcome to Dr. Stump, who will be speaking to us about more than just healthcare tonight, our self-care, navigating physician well-being in a complex healthcare system. So thank you so much for being here, Dr. Stump, and go ahead and take it away.
Wonderful. Well, thank you so much, Dr. Heinen. It's so nice to be here. I know a couple people from the New York chapter. I'm not sure they're on, but it's really, I feel very, very honored to be your guest tonight. So thank you so much. So tonight we have a lot to cover. I was a little torn about how to fit everything into the time, but we're going to get as much done as we can. And really, this is intended less to be a data talk and really to be more of a discussion. So I really would welcome people in the chat and just make it a little bit more interactive. But I really wanted to talk tonight about really discrepancy between historically physician wellness programs and really what our needs seem to be as they're evolving in our careers and really what we need as physicians, and how can we match that with what we're offering for well-being and curriculum and for our ACP chapters, and discuss specifically how humanism practices can lead to better coping skills. I have a background in humanism, and I'd like to present a little bit of that tonight to see if that reaches you, and maybe it does, and maybe it won't, but just to sort of expose you to a little bit of that. Also discuss some physician wellness programs that may be working well in other chapters, give you a little bit of what we're doing in Rhode Island, see if any of those strategies can help with your chapter. And then address strategies for empowerment and advocacy, because I really feel like we need to make sure we're feeling valued, seen, and heard in our current workplaces and beyond in our complicated, complex medical system that we're all working in. So I wanted to start with a case, and this is a case of a 44-year-old primary care physician who works in a hybrid academic community women's health practice. She's worked at the same clinic since completion of her residency approximately a decade ago. Up until 6 months ago, she felt busy, but a sense of relative contentment with professional work. She had the autonomy to set her own schedule for the most part, see a reasonable number of patients, allowing for teaching and learners in her clinical setting, and was able to really utilize some of the skills and certifications that she had attained and felt relatively valued in her workplace. I'm not sure why there we go. Not sure why my animations aren't working. So we'll go with this. So as of 6 months ago, her clinic was taken over by a more corporate system. She had some women leadership in her clinic that were fired. They were let go. Several key services which she was involved in which were passion projects and interests were discontinued without any real notice. There is little discussion regarding bringing these back, despite multiple meetings that she tried to have with leadership. This corporate health system implemented minimum number of patients per week, rapid panel expansion, and the physician began feeling immense time pressure that she hadn't experienced before this. started feeling very overwhelmed, looking at her schedule, very underappreciated, and felt herself feeling sad. She'd never had a sense of dread going into work before. She'd look at her clinical schedule, get that feeling of weight in her chest and substantial anxiety. So after many months of deliberation and struggle, she decided to give her notice to leave her practice, which was a really big decision. In addition to the stress, one of her closest friends from graduate school of 20 years ago was diagnosed with ovarian cancer at 45 and was put on hospice several weeks into all of this happening. And her friend leaves behind 2 young children, a husband and a brother, and loving parents. So any thoughts for this physician? I wonder if, this struggle sounds pretty familiar to people of professional struggle, also meeting with personal grief and struggle at home. And I mean, there's some chats up, but in the interest of time, I'll just go ahead and say that this physician's me. And when I was asked to do this talk, I thought, till I wrote back and said, gosh, I don't know if I'm at a good place in my life and career to be giving a talk on well-being, when in the past 9 months, I feel like my life has kind of taken an upheaval a little bit, both personally and professionally. So I decided to sort of turn this story into the crux of this talk. And obviously it's not just about my life, but I hope that through me sharing my story, we can find ways of feeling that even well-being champions, of which I am for the Rhode Island chapter, we can find a way to recognize that we all struggle at different points. And at those points are specifically when we need even more connection, even more, options like we're going to talk about tonight and offerings. So, I feel like only when we're brave enough to explore the darkness that we all have coming into our lives will we discover the infinite power of our light. And this is Brene Brown. She's used a lot with motivational speaking, and she's a psychologist, if you're not aware of her work. She's really pretty inspiring and very helpful of processing different things professionally and personally. And I've found her very helpful this past year in navigating some of the things that I've been going through. But, more on to sort of a more general discussion on how do we sit with this discomfort of maybe not feeling well or not feeling at our best at work, both, again, professionally, and then bringing into, if we're having struggles at work and then one thing happens at home where, it's a stress or a loss of a loved one, a relationship that ends, a divorce, a stressor with your child or loved one, how do we separate that, or can we, and is that possible? So how do we sit with this comfort of not feeling well? And though we typically struggle, though we typically feel alone when we're struggling, you look around and you think, oh, my colleagues look like they're doing so well, right? They make this look so easy. It's really this sense of imposter syndrome we'll get to that, that everyone's struggling at some point. And at some point, these struggles will probably happen to others at some point in their career trajectory. So, and when they're happening, it's even more likely that we say, oh, don't have time for wellness things, right? This is the last thing I want to talk about is how to make more things that I'm supposed to do. So how do we create that space, and how do we do that in a time when we feel the most overwhelmed? And so this idea of this imposter syndrome that, oh, my patients must be able to tell that I'm not at my best, this patients must be able to tell it. They may be able to tell that you're not at your best, and maybe that's okay for you to be a little vulnerable with them and say, not without oversharing, but there are some things going on with me, but I'm going to attend to you right now and still give you all of my presence, right? So I think it's holding both of those at the same time. So we'll talk a little bit about self-compassion, and then finally what it means to truly create a community. And just the fact that this series is happening at the New York chapter makes me really excited, because it means that there's a space, there's a community, and there's discussion around these topics. And I think that's such a step in the right direction. So everyone's heard of imposter syndrome, but I actually kind of wanted to define it and use it as a symptom of kind of feeling how I felt a little bit at different points this year. Because again, here I am as the well-being chapter of Rhode Island, and I'm feeling like, my gosh, I'm about to like, leave my primary care practice that I've been for 10 years, and and all of these things. It felt very much like, gosh, am I being an imposter because I'm not feeling well? And I think what I've come to terms with over the past few months with a lot of reflection and processing is that a well-being champion shouldn't always talk about well-being and be that model of well-being, because that's unrealistic, right? But rather, I think that potentially, it's okay to admit that I'm not doing as well as I had been, right? And that's okay, to promote that vulnerability and the ability to show that everyone struggles, and really show by example that telling our story can to potentially build connection. So if you're not familiar with imposter syndrome, which I'm pretty sure probably everyone on this talk is, and you've heard the term, it's actually that fear that others will eventually uncover your perceived weakness and the question your competence. And really for me, it wasn't, professional competence. It was more like, are they going to see that I'm not going to be able to be at my best, and will that affect our clinical relationship and those types of things, or my performance? And so things that I've tried, and again, I'm not trying to make this all about me, but I'm hoping that by using myself as an example, I can show you that there are certain things that have helped me and have helped others in my local chapter that have come to me through some times that they've had struggles. So first of all, I think self-compassion is a term that's being used more and more. And I think we're kind of starting to throw it around a little bit more than we had been, which is good. But it's a great practice if we start cultivating, excuse me, this idea that, I have to just accept that I know that I'm not going to be at my best, right? If instead of comparing myself to where I was 6 months ago, I know that things have changed. And right now I'm just going to accept that I'm not going to really be at my best at this moment. And that will probably change. There will be another point in my life that I'll hopefully get back there. I try to let some little things go, right? I try to not fight all the battles. Like, maybe this little stuff going on at work, or this little battle going on at home about one of your kids saying, I don't want the whatever at dinner, whatever it is, it's like, maybe I'm just not going to fight that battle today, right? And sort of give myself a little bit of, again, self-compassion. Writing is something that's important to me, so I kept writing, and I'm going to talk about narrative medicine in a minute, but I did try to find 2 minutes, 2 to 5 minutes a day, which sounds like, how can something 2 to 5 minutes a day really do anything for you? But as I tell patients about movement, just before I gave this talk, I had seen a crazy clinic day of 19 patients that they put on my schedule, and barely got lunch. And I thought, you know what, again, going to try to give a talk about wellness, I'm going to do a 2-minute stretch in my office. And I did that, and it really recentered me for this talk. So I do think that there's ways of shifting our focus, even if we don't have much time. I actually took advantage of a professional coach that was offered through our Department of Medicine. We're really lucky through some advocacy and showing the data to our Department of Medicine. They actually have 2 or 3 professional coaches, and I would try to advocate for that through your departments if you can, because it's really helpful. They were offered for free, actually, so it's really nice to kind of take that financial burden away from you, and you already feel like, gosh, now I have to pay thousands of dollars for a coach out there. It's really something that's really great if your departments would consider that. It's also a great way to practice. I'm not a professional coach at this point, but I've considered it, and it's a really great way to interact with colleagues in a different manner. So in any case, that really helped me through the year navigate some difficult conversations about professional things. And so I talked to colleagues. I didn't keep things quiet. I actually was pretty open about the fact that I was struggling, because in my practice, a lot of them were struggling too with all the changes. I made a point to be more present with my family, particularly my little 6-year-old, and because it's just trying to really carve out the point and using my friend as a reference that really life is fragile, and with all of our professional work that we do, we have to make sure that we're keeping those connections that make us the reason why we're doing this work, right? And so I just let people who I love know it. Friends, colleagues, family. I really feel like it's brought me to the core of really what's important. And and we're going to talk about this in the rest of the talk, this whole self-care of like, yoga is not enough, right? That's self-care. It's not just about self-care. But that being said, because for me, movement is one of my self-expressions and something that's such a cornerstone to, I feel like, what makes me who I am. I felt like I can't let that completely go. I used to do something 4 days a week. Now it's been like once or twice, and maybe it's 5 minutes, or maybe it's 15 minutes, or maybe it's 30 minutes, but I do make time for it, but it's not always a lot of time. It's not as much as I'd like, but it's better than nothing. But also, I don't blame myself if it doesn't happen that day, right? So again, practicing that self-compassion. So I'd like to shift gears a little bit and present to you a little bit of a taste of narrative medicine. We're going to do this for like 5 minutes. We're not going to take as much time as I typically do when we do narrative medicine exercises, but I'd like to present this Rumi poem to you. Maybe you've heard of it, maybe you haven't. It's a really great dipping our toe in to some of this work, I like to say, just to get a sense. So I'm going to read the poem, and then if anyone would like to do a second reading of the poem, we can do that. If no one volunteers, that's completely fine. But I'd like, while you're listening to me read it, try to kind of read it in your mind as well. If you're not in front of the screen, that's fine. And then just we're going to sit with that and see what resonates with us. Okay. So this is the guest house. This being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they are a crowd of sorrows who violently sweep your house, empty of its furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whatever comes, because each has been sent as a guide from beyond. I'm looking at the chart here, at the chart. I meant the chat. I said chart. So, and I'm seeing a familiar Daniel Pomerantz in the audience here. So if anyone wants to, if anyone wants to, now I'm putting him on the spot, so now he's going to have to read this for me.
I'll read. I'm more than happy. I was about to type, I'll read it if no one else volunteers. So
that's what you get for knowing me. Go ahead.
I'm just so grateful that you're here. Thank you.
Thank you.
The guest house. This being human is a guest house. Every morning a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they are a crowd of sorrows who violently sweep your house empty of its furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whatever comes, because each has been sent as a guide from beyond.
Thank you, Dan. So when he reads it, see, I'm hearing even more things that I didn't internalize the first time, and which shows just so much. So it shows what you can see through different readers. So, and I know the lovely Dr. Pomerantz through our sessions that we do with narrative medicine each month through different ACP chapters, and we'll get to that in 1 second. But before we move to that, just an invitation to share from anyone how just anything you noticed, language that was used, what emotions evoked that were evoked with this. I see Dan's hand. Again, I don't want to play favorites, so let's see if there's anybody else here. All right, go for it, Dan.
So the first thing I thought is actually a little phrase I have pasted on my door from Charlotte Jacobek, who's a meditation teacher. Joy is exactly what's happening minus our expectations.
I love that.
Which, sort of whatever it is, it's not what you expected. And then the other thing, as you were reading the poem, the first image I had was from the very end of The Hobbit, when Bilbo returns home to see, the contents of his house being auctioned off.
Mm-hmm.
It's
Yeah.
just,
I think this is Ian Lustbader, that really beautiful. And I think we're so conditioned to avoid pain and only believe that good things are beneficial. And I think this raises our awareness that even pain, all experiences add to our sensitivity or can be meaningful,
Mhm.
and not we shouldn't necessarily view something as positive or negative, even if it creates some pain, because that may create space for growth in some other way that we don't expect.
Yes, thank you so much, Ian. That's exactly the crux of it. That that joy and darkness and joy and grief and joy, all of these can exist at the same time. We actually, as humans, hold the capacity to hold all of these emotions all at one time. And actually, the ability to do that makes us even more human, makes us feel things even more deeply. So thank you so much. So that's exactly what I was hoping you'd get out of this. So allowing ourselves to simply be with whatever comes, right? Welcome them all in, welcome them all in. So all of these things that we see, even with our patients in one day, right? There's such a gamut of emotions evoked from people's stories. And just also realizing that even if it's darkness or grief, it's temporary. Again, not that you're not always going to feel a sense of sadness or grief with loss, but they may not always stay in the forefront forever, and they're not going to stay in the forefront forever. So rather than shutting out or suppressing these struggles or these darker times, learn to potentially, with some practice, learn to potentially come and welcome them in. I think we're so quick to try to shut out the difficult, that we leave out that space, and it actually makes the suffering worse. So again, as Ian said, we can let joys in even if we have sorrows visiting, and vice versa. They can coexist at the same time. And that's what's so beautiful about practicing medicine, is that in the same clinical interaction, in the same day, or in our own lives, we have the potential to hold both grief and joy at the same time. So just a quick blurb on narrative medicine. Most of my work that I've done, I do at Brown and nationally on wellness, stems from my work with narrative medicine. So I'm just going to give you a very, very brief, like 1-minute intro to this. Dr. Rita Sharon, she's actually just up the road from maybe some of you. She's at Columbia. So she's essentially developed this field several decades ago. That's really an interdisciplinary field. It brings together the humanities, it brings together medicine, and it brings powerful skills of radical listening. And that's really it's such a cool term, right? Radical listening. What does it mean to radically listen? We're so conditioned as physicians to listen for history. How long, where, what's the quality, what's the quantity, pain. She's talking about radical listening in the way that you just did, in more of an emotional awareness and more of a way of listening for keywords, emotions, those types of things. So it really evokes more of our creative side, a side that we don't always get to use. And so it's a lens to really explore also some structural inequity and social justice in healthcare. Her narrative medicine conference last April was all on DEI and all on social inequality and structural racism in our country. And it was really interesting how using narrative medicine as a tool opens so many ways of discussing these issues as well, and topics. So attending to, being moved by stories, it's just one mechanism, right? But it's so powerful if you try it, right? I've seen people really, really open up through narrative medicine. So something that I just wanted to give you guys a quick taste of. And so, I think when we talk about, when we talk about humanism, so there was a study that Dr. Heinen sort of referenced, and I'm glad you brought it up to me because I read through it. It's really, gosh, I don't know why that keeps happening. Sorry, really, really interesting. So there was a study of like what makes physicians in clinical practice more humanistic, like, or what are those attributes? And so University of Pennsylvania, a while now, and I was like, wow, 2011, right? Seems like forever ago. They did a study of attendings to see what qualities they were demonstrating. So attitudes for sort of sustaining humanism in clinical practice. And the cohort of physicians, they sort of looked at what are these qualities. So it was a humility, a curiosity about people's lives, and a desire to live up to a certain standard of behavior. In other words, not being willing to compromise how you practice medicine despite the environment necessarily which you work, right? And saying like, this is how I have to be able to relate to this human, even though I'm being pressed for time. I need to be able to see, I really need to still be able to relate to them, right? And so, they worked at maintaining their attitudes and they followed them over time, and those habits actually help them engage and sustain their humanism. And what was that? Those were qualities of self-reflection, the ability to continue to connect and be present with patients, the ability to teach and role model this for other learners, and achieving a work-life balance, which is, again, not an easy thing to do. But it was an interesting study that showed us like what actually are those attributes. And physicians in the study believe that treating their patients humanistically, right, actually helped themselves prevent more burnout. So point being that, maybe if we practice some of these skills, it will help us both personally and professionally. If you're interested in this more, just a little plug on our writers wellness workshops that several different ACP chapters. We got North Carolina represented, Rhode Island, New York. I'm sure there's other states that I'm forgetting off the top of my head, but it's a great group of folks. Dr. Daniel Pomeranz is there most months. And so we have a good time sharing and just being a great community. So there's other ways though. So some people feel like, oh, I'm not a writer. Again, this isn't about being a writer, right? This is about sharing and listening to stories, but maybe that's not you. And maybe that's not something you're interested in. I always say it's like, this shouldn't feel like a chore. So when you do things that are outside of work, you want to make it something you want to do, right? Because we spend a lot of time doing our professional work, and there's things that we're checking boxes all day. So make it something that appeals to you, right? So maybe it's going to an art museum and looking at art. Maybe it's drawing. Maybe it's picking up a paintbrush. Maybe it's taking a photography class. Maybe it's just doing photography on your own and seeing if whatever it is. Those are other types of medical communities. I love dancing, and I see Dr. Patricia Ng on the call as well, on the presentation, who's a co-resident of mine, who's a dancer as well. So that's always been something that moves us, right? Moves me, and so that's always been an inspiration. We're actually developing we've actually developed Up Brown for our internal medicine residents. Arts and medicine track, and residents and faculty love it. It's actually talking about these things, and it was a very, very popular track, and hopefully it will continue to be sustained because of its popularity. So, and I think it's made Brown a little bit more attractive and unique to applicants too. So working on a curriculum for medical students as well, and so some things that you can think about for your medical schools and your chapters potentially is something called Lunch and Be, right? So I think there's lunch and learns. And so we were like, people are tired of learning at lunch. Maybe we need a little mental break at lunch rather than trying to cram more information after a morning and afternoon full of, cognitive processing. Maybe we just need to be a lunch and be. So we sort of started these lunch and beat offerings for medical students who also really love it. Maybe we give them a piece of art to interpret. Maybe we give them a poem to interpret. And they're really digging it so far. They really love it because, again, it's a lot of information, and just letting the brain work in a different way and turning on that creative brain is sometimes really important. I wanted to switch gears a little bit and talk about sort of the evolution of well-being and wellness programming then and now. So I think we all know that then we're very familiar with the past, 10 to 15 years, probably when we started training in medical school, residency, and then our time out. And the past 2 decades have really been focusing on bringing physician burnout and bringing this into light. So we kind of know that then we've had more prioritization of this, duty hours have become an issue. We've talked about wellness awareness. But where are we going from now? Because I think we're now into the action phase, right? We've done a lot of talking. We know it exists. We know the problem, and we're kind of tired as a group collectively about sort of talking about the problems, right? We know what they are. And so now we're kind of focusing on how we can make better system changes to reduce administrative work burden and really shift away from awareness to action. So that's kind of where we're headed. So this is a great article if you guys have the chance to check it out. It's not oppressively long. It's something that you can easily digest. It's Tate Shanafelt. It was published in the Mayo Clinic in just a couple years ago in the height of the pandemic. And so it's talking about where we are and where we're going in well-being. And so as I was saying, we were kind of in this era of distress for a while, which was, about 2 decades ago, where, doctors were there. There was no limits on work. Self-care was kind of out the window. The harder you work, the better you're perceived. Maybe we all some of us trained in that, and to take a break or to, be like, I have to be out by 6 o'clock to make it to a yoga class was like, no one would ever do that, right? Creating limits and boundaries were not something that we talked about. Then we moved to Wellbeing 1.0. And as you can see, I love this little visual. We're getting a little bit more sprouts and leaves on the tree. We're talking about wellness. We're bringing up work-life balance, but we're hearing words like resilience, like doctors just need to be more resilient. And there was a lot of frustration because it was sort of like administrators versus physicians and just a lot of, not combative, but just not really a lot of common ground. Of doctors blame administrators blame doctors, and so why don't they just work harder? And we're like, well, you don't know what it means to do the job we're doing. So that was the second era, and now we're kind of moving into this well-being 2.0, which is what the author really goes through. And how do we see the next decade of well-being, and what does that really mean? Being that our medical system continues to be more and more complex, which is kind of the reason I got the talk title, which is sort of inspired me. So now we're talking about recognizing, as I was saying, that the physicians are humans. We have human qualities. We need breaks. We need medical systems and healthcare systems to recognize this. And we're really searching for that meaning and purpose, again, back in our profession. We're really searching for that community, but we need to be able to practice self-compassion too and say, I know I'm not perfect. I'm going to have bad days, right? So that's sort of this is another visual from the article that I really love, era of distress. We're not even, we don't even know how bad it is. We're not even talking about it. Moving now to this awareness, but really a sense of blaming, right? A sense of adversarial between physicians and administrators, as I mentioned. And now we're really moving into saying, okay, if this is ever going to get better, doctors themselves are so buried in clinical work. We're busy. We do the work. We generate the bills, right? Regenerate the driving force of this healthcare system. But we're doing that. We don't always have time to have a seat at the table. So how can we advocate for ourselves in order to get into a better place where we can work with, again, cultivating together a better system for us all to work in? And so really the sense of a shared responsibility, right? But in order to get really value in our investment, we have to actually be able to talk with the administrators, talk with the stakeholders, and figure out a way of making this work for everyone. So it's really about now we're in an action phase, which is a little daunting, but also a little exciting. So I wanted to give you some data from my chapter. So this is a survey we did back for Rhode Island ACP members. This is all members. In 2023, you can see not that many responses. However, Rhode Island's a small state, so our ACP chapter is not nearly as large as New York. So cut us a little slack, but 42 responses. But I said to them, like, what do you want? Here I'm kind of like, here, be a well-being champion, but it's like, who's going to come to these events? What do you guys want? And as you can see, it's spread all over everywhere. So then I had a hike and a few people came, and then we did a bike race and a couple of people came, and then we did a breakfast. And even though they're asking for mindfulness breakfast, one person came. So, you're dealing with trying to create programming when people are overwhelmed, people are busy, and how do you actually make this work? The physician coaching, only 11%, 11 people, 26% was something that I can use with the Department of Medicine. We talked about that. And that's really popular. And that's actually seems like people are finding that really helpful. This finding meaning in medicine was also one of the leaders. And that's why narrative medicine addresses that. And, connection, right? A couple other things we're doing in a chapter called the third chapter, and the second chapter, third chapter is for folks kind of moving towards retirement, if you will, but they're not quite there yet, but they're kind of in the third chapter of their careers. And second chapter is, I'm no longer feeling early career anymore, but I'm kind of middle career. And how do I balance the demands of being a sandwich generation with maybe elderly parents and younger kids, and all those things with it there. And those chapters are really beneficial because people need to kind of process how to balance that with their work. So it's more than just work-life balance, it's actually feeling that connection. So what it seems physicians are looking for now is not just kind of ways to be active together, or not just ways, but it actually seems like, at least what I've found, and this is just, love to hear other people's feedback too, of what's working in their chapters, but what seems to be helpful is creating that sense of connection, that sense of community, a place to processing what's happening in their professional lives and careers, whether that's through writing, whether that's through talking, whether that's through, trying to figure out advocacy and work with your local, like I said, Rhode Island Medical Society, work with your local medical society about so again, those are things where people are bringing together. That's sort of what it seems. I struggle with this though, because I do also feel like, we keep thinking about this in terms of self-care, and I don't want the takeaway from this talk to be like, oh, self-care is not important, because it is important. And so, but I think it's more than just self-care. So, because for so long it was like, I have training in yoga, so here, come teach a yoga class, or, and it seems like, but if that's all we're offering, it seems to think that that's what we're saying will solve the problem, is if we just do more self-care. And we all know that it's more about system change, right? But it's not that we should neglect our self-care. So self-care is important, right? The lifestyle medicine tenets like sleep, eating well, moving our bodies, like those things we have to try to do as much as hard as it is, but it can't be all that we're looking to say that that's wellness, and you all know that. So the system change is really what I think we need to vocalize, and in order to change it, we can't act alone, right? We need to figure out how we can partner with our stakeholders. In my situation, it's I feel like it's very different when something corporate takes over your practice. You're like, I don't really feel like this is a democracy. I kind of feel like this is a little bit of a dictatorship, right? It's not really working. I'm trying to advocate for myself, but advocacy actually seems like it hasn't been as effective as we would like. So which brings us to the point of, if we're going to communicate I'm sorry, I'm having trouble with my keypad. If we're going to communicate our wishes, how do we communicate them? So I love this quote by Eckhart Tolle, who was, kind of in vogue about 15 years ago as a contemplative philosopher. But he says, where there's anger, there's always pain underneath. So at first, when this was happening, I was just so angry. I was like, how can this happen? We have a great practice. How can this, how can our programs just be cut? How can my acupuncture clinic just be cut when I was so busy? I was helping people in pain. I was helping cancer patients. How can you cut a service like this at a healthcare system? So I really struggled initially with anger. And I love this Audre Lorde quote, who's a feminist who, isn't afraid of sharing her feelings. So I was like, there's anger, and maybe there's space for, I can't hide my anger to spare your guilt, nor hurt feelings, nor answering anger. For to do so insults and trivializes all our efforts. So it's like, how can we hold this anger, and also knowing it's not just about me hiding my frustration, maybe trivializes all of what physicians are going through with kind of the corporatization more and more of medicine. And so I was sort of like, gosh, I feel like this is larger than myself, so I can't just be quiet about it. But how do we do this in a way that's productive? And so that's really the third part of this talk, is I really want to talk about how do we hold on to anger in a way that is in a way that's not toxic, right? So holding on to anger is like drinking poison and expecting the other person to die, right? It damages us almost more than it damages the other person. And I think that's something that's really a lesson, and something that's not always easy to internalize. So I feel like I needed a vision of how to work myself way through this. And the only thing worse than being blind, this is Helen Keller, who was blind, right? The only thing worse than being blind is having sight but no vision. So it was one of those things where I feel like it's almost like you need to envision where you want things to go before you start yapping. Not even yapping's not a good word, but before you start, trying to sort of talk about your case and be like, what's going on here? So I'm using this slide from ACP. So if you haven't heard of the Many But Mighty series, it's a really great series of several physicians who started Many But Mighty. So that really the wellness movement through ACP was started by several, and this is a really great slide of talking about really anti-violent communication. And violence, like, a really strong word, but I think when you're having these key and crucial conversations with administrators and stakeholders, I personally have made the mistake, and I'm sharing my mistake to hope that others don't necessarily fall in that. But coming to a place of from anger and frustration comes across as sometimes feeling like I'm acting like a victim. Like, how could this be happening? And so what I've learned and realized over the past year in these experiences is that actually practicing a little bit of mindfulness to gear yourself up for these conversations, and while you're in these meetings, is really important. Like, here's the facts. This program was cut. I'm really angry about this because I know this is benefiting hundreds of patients, and now these patients are not going to be able to afford these programs because they were covered under insurance. My intention is to get these programs back because I feel like that brings value to our health system and their care. And so my request was to bring it back, but my response was met with no, not any discussion, but no. So when you're confronted with a hard stop, where do you go from there? How do you really even work from there? So essentially, I use that example as that our experiences give us all of this lived experience to say, okay, what would I have done differently in my ask next time? Maybe I would have asked in a different way. Maybe I would have brought it a different way. And maybe that wouldn't have worked, but maybe it would have made more of an impact. Not sure. But again, we all learn from experiences. So when we identify our needs and we can better control our initial emotions and ask maybe in a different way, maybe things change. So we may not have time to do this practice together, but you guys should have the slides. But I think it's a good exercise. This is something the professional coach and we talked about, and it was really helpful because, something I recently saw or experienced in my professional work was this. When it happened, I felt this way. Usually it's a negative emotion we're talking about. I think I felt this way because I needed this. I needed more recognition for this. I needed more whatever. I needed whatever we need. Based on that, next time I can try this. So it's a Many and Mighty session. If you go look through the Many and Mighty at ACP, they have a lot of cool stuff like this to explore. But I think if you're working with a colleague, you're working with even a resident, you're working with a medical student. This is a great structure to talk about if they're confronting a struggle and they don't really know how to sort of master that conversation. And here's just for other people who maybe learn in different ways. I thought this was another great way of kind of articulating our feelings. So sometimes it's really important to name those feelings. As it says, if it's something if you can name it, you can tame it. And I really love that, because sometimes we're just so wrapped up in, we think it's anger, but as that prior quote said, a lot of anger is just pain. You're feeling like you're not being seen, you're not being heard, and that's why you're feeling angry. So I love this. I love this chart. So feel free to use it. It's ACPs, so feel free to give ACP credit and use it in some of your work too, because I just think it's a really great chart that needs to be spread around. And again, another exercise, something I recently saw was this, or experienced when this happened, I felt this, I think I needed, and then think I felt this way because I needed. So it's a nice practice on really trying to articulate feelings to needs, which means, again, feelings to action. So I think it's a great thing. So, but just reminds us that all of this can come back to a little bit of mindfulness, right? So I teach a mindfulness-based stress reduction. MSBR is a long program, as you guys know, if any of you've done it. It's 8 weeks. It takes a lot of hours. So we've created what we call like the essential oils of MBSR, and we call it MBAT, mindfulness-based attention training. And so we're teaching that to the medical students, and it's only a 4-week course that's an hour and a half, 2 hours long. So it's essentially half of the regular, because let's face it, medical students don't have as much time and attention to devote to this. But one of the quotes we use is this Viktor Frankl quote, who was a Holocaust survivor and a very wise, right, person, who said, between stimulus and response, there is a space. In that space is our power to choose our response, and our response lies our growth and freedom. So if in retrospect, because all of this happened very suddenly for me, I don't feel like I had a lot of time to pause. I felt like I had to act. But in retrospect, had I created more space between the stimulus and my response, maybe a different conversation would have happened. And so I invite us, when things are challenging, to just, whether it's the argument that you're about to respond to, or it's something more major, just think about creating that space. So this brings us back to mindfulness. And so without getting into the weeds of mindfulness, because it's so much and it's wonderful, but we don't have time. But I think, how do we practice creating space between this and in our daily lives? I think doing, I love the Calm app. I think it's great. Headspace is a great app. Whether it's giving ourselves 1 or 2 minutes to just kind of reset from the day or whatever. But I think mindfulness can be very powerful if it's practiced. It's a great skill. We say, like, we go to the gym, we think about working on our bodies. What about our minds? Our minds can become more better performing. They can become more optimized, but we have to work on it just like we do in the gym and our bodies, right? CBT is also really helpful if there's something that's like, I am getting stuck in this cognitive distortion and I just cannot get myself out of it, right? So CBT is really, really great. And probably worth the 6 weeks of your time with a psychologist or whatever. So I'm a big proponent of psychology, and that physicians as a field probably need it more than most fields, right? And so coaching is also really, really helpful. Like, there could be just one thing that you're really stuck on, and it doesn't mean that you need to sit there and have a psychotherapy session about your child and everything. You need to figure out how to navigate the situation. And so I think professional coaching can be really great. And then also, I just come back to your other stuff that you can do to use that processing. So in the midst of doing that, though, if you're trying to create space, then it's talking about what can we let go of. And I think this is also an ACP slide, but I really love it. So I've just kind of recycled it and reused it. But how can we better embrace or let go of things, right? So what do we say yes to? What do we say no to? I am a big yes person. I say yes to a lot of things, and I don't regret it necessarily, because I feel like I've had a breadth and depth of a lot of experiences. But I will say that for something you say yes to, you're gonna have to, like, it may take away from from other things, just in terms of time. I always often feel like there's not enough time in the day to do all the things I love. But I think this is a good exercise too, what can I better say yes to? What can I say no to? Like, and thinking about this in terms of our professional lives, our personal lives, kind of our spirit, like what feeds my spirit, and what kind of, when I'm around certain things or people, I'm like, this isn't good for my spirit. And I think it's just a great little activity. And I think there's another thing in terms of cultivating a sense of empowerment and time management, because I want to leave time for questions, so we're almost there. And it's living in our circle of influence. Like, we have so much going on in the world, and I'm somebody's like, let's go out, change the world. I'm going to, change the healthcare system. I'm very much like a doer, but sometimes I need to sit back and say, what's really in my circle of influence right now? And maybe just that person in front of me. Maybe I'm just lighting one light of one medical student, and they're going to light another light. Or maybe it's just that one patient that I can change. Help them, their suffering. And so, I'm probably not going to solve all the world's problems, right? But so sometimes it's like coming back to like taking the pressure off ourselves and saying, what's really in my circle of influence? And so sometimes that could be that helpful when navigating how complex our healthcare system is too. So again, by identifying our emotions and pausing, really to create space prior to reacting, we can really create a better, more supportive environment for everyone, for us, for the people we have to work with. And so just thinking about our communication skills is really important, which creates a sense of belonging. I'm going to skip this slide because I don't feel like we don't have time to go into it, but it really talks about belonging and creating a sense of, the belonging, inclusion, and both our daily work and our sense of the healthcare system as a whole. But it's a little bit complicated and we don't have a lot of time. So in this new era, right, of 2.0, right, we're shifting away from a culture of wellness to one of really vulnerability and self-compassion, which really is wellness. But I think thinking about wellness in a different way. It acknowledges that physicians are not perfect, that they're going to make mistakes, they need to be vulnerable, and they need to support each other through those times. I love this. This is from the article that I was referencing. And it says, physicians recognize and acknowledge they may have an Achilles heel as it pertains to perfectionism and self-criticism, and dedicate themselves to developing skills to address these mindsets. So it's realizing that we will make mistakes, and that we need to be vulnerable to support each other through this time. So how do we navigate this roadmap? I think, and this is nearing the end, I packed too much in. So I think essentially, I think that main point of the slide is reject the role of victim. We need to be part of the solution, and casting off sort of our narrative of learned helplessness. Like, okay, this is never going to get better. The healthcare system's never going to change, because actually that's kind of a barrier to creating system change, is sort of saying, it's never going to get better, so I'm just going to like bury myself in work, right? We have to find a way. So one example that some physicians are doing is unionization, which I bring this up not as a political thing or anything, just giving people examples of advocacy in action. Really interesting. Residents, house staff across the country are really starting to recognize these things and say, like, we deserve more of a seat at the table. So it's very interesting. And how can we as attending support our house staff who are doing this? Where do we walk the line, and how do we hold space again between these two different things of advocacy, but also, kind of holding that at the same time? And so Northwestern, largest group of young physicians to unionize, 1,300 physicians. Other academic medical centers who've done this: Mass General, UPenn, Montefiore, Stanford, USC. So it's really interesting. And so how do we think about how we have more of a seat at the table? And maybe this is a really good option that I think we should all explore in our local and our states, and kind of figure out, is this a reasonable option? So finally, when we're asking we're asking physicians, would you unionize? A lot of them say yes, but I feel like it's not an option for me. And a lot of the reasons cited are, I'm scared. I'm worried professionally about what my organization would say, or my professional image, if I said I would do that. So again, back to ACP, right? There is an advocacy network who does a lot with DC. They always go to Capitol Hill each year. And if you're interested in any of the advocacy work, ACP is a great place to do that. So I'm going to skip the gratitude. I think we all know about that, and just sort of say and end the talk. So as I want to have time, released 1 or 2 questions, is that to thrive during these present and challenges in our healthcare system, we're going to have the courage to be more vulnerable, share your story, listen to your colleagues' stories when they come to you, and realize the connection and common ground. We're going to advocate for ourselves, our patients, and our profession, but do so from a place of seeking solutions and not always blaming and not always anger. Well-being as belonging, acceptance, being seen and heard and valued. And so I love this, again, starting with Brene Brown, ending with Brene Brown, but choosing courage over comfort, choosing whole hearts over armor, and choose the great adventure of being brave and afraid, but being brave and afraid at the exact same time. I love that, being brave and afraid at the exact same time. Same with being joyful and grieving at the same time. So owning our own story and loving ourselves through that process is the bravest thing we'll ever do. So thank you for this. This is some other well-being resources, Many But Biting, support hubs. If you haven't, I'm sure you've gotten this from your own chapter, but these are always great to just have. And you guys will have my slides, but I always love hearing from people. So feel free to reach out to me. So I will end here.